Welcome to 2-Minute Cardiology. My old buddy Robert Davi, most noted for those cult classics, License to Kill, Goonies, Showgirls, and Die Hard, asked me, "Hey Evan, what's the story about aspirin and prevention of heart disease?" Well, let's talk about aspirin a little bit in under 2 minutes. Aspirin began as salicylic acid, believe it or not, in 500 BC. In Bayer, in the late 1890s, made something called aspirin, which we know as acetylsalicylic acid. Now, in the 1930s, doctors in California noted that in kids that they asked to chew gum after tonsillectomies, they started to bleed. We know that aspirin inhibits something called cyclooxygenase, and that's needed to make thromboxane, which causes platelet aggregation. Without that, you can bleed. You have increased bleeding. So here we go about heart disease. We're going to talk about two parts of heart disease: primary prevention and secondary prevention. Okay? Secondary prevention means you already had a vascular event, a stroke, a heart attack, and for most of those patients, you need to continue taking aspirin. Primary prevention, that's what we're talking about. You never had an event. What should you do? Well, until a number of years ago, just about everyone was told, take an aspirin, reduce your risk. But lately, trials show that sure, it can reduce the risk of heart attack, but at an expense. Just like those little kids bled in their tonsillectomies, people can bleed. So, most trial data show that if you're over 70, the risk of bleeding increases substantially and probably for primary prevention, not secondary. You shouldn't be taking aspirin. Less than 40 or 40 and under, in your 40s, your risk is probably low enough you shouldn't be taking aspirin. And then there's this magic number, 50 to 60. If you have a very high risk of a cardiovascular event, you might do better by taking aspirin, and you should speak with your doctor. That's the magic number. So remember, aspirin does reduce the risk of heart attack, but at a potential expense, especially in the elderly over the age of 70. Most of those people should avoid aspirin for, that's right, primary prevention. Secondary prevention is a different story. Thank you, Robert Davi, for asking me to discuss aspirin and primary prevention for coronary heart disease.